This is part of China's response to COVID-19. This traditional Chinese medicine is called Lianhua Qingwen jiaonang, and it's being distributed to people in Hong Kong and mainland China to fight COVID-19. But what exactly is it? And how is Chinese medicine being used in the battle against the virus?
Basically, Lianhua is actually the short name of two herbs. Qingwen basically means alleviate pandemic. Okay, jiaonang is just a capsule. So literally, this is the name, what it means. It is a over-the-counter drug that actually includes about 13 different herbs in it. And it is, yes, target for curing COVID-19 patients, in particular, patients who have a high fever. By high meaning 38, 39, up to about 40 degrees Celsius.
The mainland government has been using traditional Chinese medicine, or TCM, in addition to Western medicine to treat COVID-19 patients, in an effort to help speed up their recovery and rehabilitation. Hong Kong leader Carrie Lam said that TCM treatments for the coronavirus have proven effective based on the mainland's experience. People in Hong Kong and China have received Lianhua Qingwen in government-provided anti-epidemic packages. On the box, it says the medicine can clear scourge, remove toxins, diffuse the lung, and discharge heat. The formula is based on prescriptions that date back to medical texts written during the Han Dynasty, some 2,000 years ago. But what is actually inside these pills?
This one is lianqiao. And this is the Lianhua Qingwen jiaonang. The lian is this one, okay? And this herb, we use it quite often for fever, okay? For anything that is related to heat. This one is Jingyinghua, okay? It's actually a flower, all right? So this one, again, typically used with lianqiao. This is also used for heat reduction. This one is called banam gan. It's actually a root plant. It is particularly effective for sore throat. This one here is called yu xing cao. This is actually the leaf of a plant, and this is particularly useful for clearing phlegm. This one is guanzhong. This is a root herb, and this particular herb is also useful for clearing fever. In some situations, we use it for heat-related rash. What is interesting about this is in the old days, we used this for clearing parasites. Last one is shigao. It's actually plaster. Plaster, we actually use it for making tofu. We use plaster in big amount, in particular when we have high fever. So the use of plaster can very quickly alleviate fever and lower the temperature.
Lianhua Qingwen is just one type of Chinese medicine used in the fight against COVID-19, with TCM practitioners adopting varying remedies and techniques to treat each patient's symptoms on a personalized level. Mainland China has been using TCM since the start of the pandemic, while Hong Kong only started to incorporate it into its response during the fifth COVID wave in 2022. With universities and public facilities brought in to help with the city's response to a devastating rise in infections and deaths. As part of this effort, Hong Kong's Baptist University has been offering TCM phone consultations to patients with mild and moderate cases. COVID patients with severe or critical symptoms were treated solely with conventional medication.
Based on our experience for the telemedicine with the Chinese medicine for the COVID-19 patients, currently we're treating around 36,000 patients in Hong Kong during the last 2 months. The effectiveness is encouraging. And we hope that we can, at the end of this fifth wave of the COVID-19, we can have more of the clinical research data coming out to show the research results of the Chinese medicine for the COVID-19.
But doubts remain about the efficacy of TCM medications, many of which have not undergone standardized clinical trials required by regulators, such as the US Food and Drug Administration, with critics citing problems in the way its trials are designed and executed. Singapore's health authority has explicitly warned its citizens not to take Lianhua Qingwen as a COVID treatment. It said, "To date, there is no scientific evidence from randomized clinical trials to show that any herbal product, including Lianhua Qingwen products, can be used to prevent or treat COVID-19. However, the World Health Organization has said that there is evidence that TCM is beneficial in some cases when combined with conventional antiviral medicines. But they also go on to say that further analysis and trials will be necessary to fully evaluate the effectiveness of traditional Chinese medicine in treating COVID-19.